next topic is Guillain-Barré syndrome. So before going to start the topic, don't forget to subscribe the channel and show some support. So let's start. Okay. So Guillain-Barré syndrome is a neurological disorder. So it mainly affects the immune system. Okay. So let's see the definition. So it is defined as it against of the immune system. It is against of immune response. Okay. By the descending tract. Okay. By the descending tract of human body. Okay. So majority of the affected part from lower limb to respiratory arrest. Okay. So it mainly affect from lower limb to respiratory arrest. Okay. So this is the definition of Guillain-Barré syndrome. So next one is causes. So Guillain-Barré syndrome is also known as polyradiculoneuritis. Okay. So I'll also give another definition. So it is an inflammatory demyelinating. So it is an inflammatory demyelinating polyneuropathy of the peripheral nerves. Okay. Peripheral nerves, and it characterized by a rapid onset of weakness and often paralysis will occur. Okay. Paralysis of extremities and respiratory muscle. Okay. So this is the definition. So I'll give two definition. So next causes. So next one is causes of Guillain-Barré syndrome. So it usually affect due to hereditary causes and chemotherapy drugs. Okay, due to chemotherapy drugs and autosomal disorder and trauma and infection and inflammation of the brain cell. Infection and inflammation of the brain cell and brain tumor, due to brain tumor. Okay, these are the causes of Guillain-Barré syndrome. So our next one is pathophysiology. So due to etiological causes, lower part of limb to upper part will be affected. Okay. So it leads to paralysis occur either in one side or both side of lower motor neuron. Okay. Okay. And next, muscle weakness, immobility and loss of sensation will occur. Immobility and loss of sensation. Okay. So that lead to it affects the renal part. Okay. And this affects the renal part and it causes the decreased paralytic movement. Okay. Due to decreased paralytic movement, abdominal distension will occur. Abdominal distension will occur due to cirrhosis of liver. Okay. So that abdominal distension will cause hepatic failure, and hepatic failure will lead to changes in behavioral activities. Okay, like confusion and loss of consciousness. Okay, so changes in behavior activities and loss of consciousness leads to, it affects the upper part of the limb. Okay, upper part of the limb will be affected, and it leads to cardiac arrest, and patient undergo endotracheal intubation. Okay, that causes respiratory arrest. Okay, so this is pathophysiology. So next one is clinical manifestation. So in clinical manifestation, first one is drowsiness. Okay, muscle weakness, headache, and headache will be a prickling pain will be there in. Okay, paralysis in upper and in the upper motor neuron. Okay, and confusion will be there, and mentally disturbances. In mentally disturbances, confusion and irritability will be there. Okay, okay, numbness will be present. Okay, numbness sensation will be present, and rolling of finger will occur. Okay, loss of elasticity will be there. Okay, these are the clinical manifestations. So next is diagnosis of. So next one is diagnosis. So in diagnosis, first history collection, and physical examination, neurological assessment. Okay, in diagnosis, history collection will be done, and physical examination, neurological assessment, MRI, CT scan, X-ray, gamma knife therapy, and EMG, and also lumbar puncture will be done. In lumbar puncture, it shows a raised protein. Okay, and Brighton criteria will be seen. Okay, so it is supported by investing the nerve conduction studies. Okay, nerve conduction studies. So these about diagnosis. So next one is management. So in management, plasmapheresis, okay, will be, and IV immunoglobulins, plasma exchange will be done. Plasma exchange to remove antibodies, plasma exchange will be done. So and chemotherapy. Okay. So next one is complication. So next one is complication, respiratory arrest. Okay. So here VTE prophylaxis will be given. So it is a low molecular weight heparin. Okay. So next one is, if respiratory failure occurs, the patient should be intubate and ventilate. Okay. And the patient should be admitted to the ICU. Okay. So here in management, continuous cardiac monitoring should be followed. Okay. So last one is prognosis. So in prognosis, 80% fully recover, and 15% with some neurological disability. Okay, so these all about Guillain-Barré syndrome. So if you have any doubts, ask in comment section. Thank you.